Assalamualaikum. Welcome to Dr.OBT's podcast. Today I have a very lovely lady by the name of Ayesha. She's a clinical nutritionist and she's recently joined Halshan, and I want to welcome her, and I'll also request her to introduce herself as well. Welcome.
Thank you very much, and it's a pleasure to be on board with you at the place as well as today with you on the podcast. So I am Ayesha Khan. Like everyone knows, it's been a long journey of being associated with the profession of nutrition. It's been more than 22 years
Mashallah,
now.
mashallah.
Yes.
Excellent.
So exactly. So when I started my journey as a nutritionist, the conditions then were so very different as compared to now. Then I think the nutrition was just in the state of evolution. So over the years, the things have improvised a lot. Now people know the significance of the nutrition.
Bilkul. I think I also have a very holistic approach to my field. So it's very strange when I'm telling some patients a bit of some nutritional, tips. And obviously, I believe it plays an essential role, vital role for everyone to be having obviously a good nutrition at home. So what would you advise on a general, your general advice? Okay, what kind of foods should people generally opt for, and what should they avoid? Just general.
Okay, you know what? You have used the very right kind of the word holistic. Now, the world is focusing on organics and holistic. But in the name of organics, one should not get so bonkered with the fact that there are plethora of the things around us and what to go for and what not to go for. The point is, keep it very simple. The more simple kind of the choice we make in food, the more compatible it becomes with our lifestyle. Sure. And I often tell people to adopt a healthy lifestyle. That's the key to choosing the right kind of the food. Secondly, I often share it with the people that the more you are going to keep it indigenous, the things which are all available around you, rather going for the exotic foods which are too exotic for your land, that's something not very, very to be welcomed. So the superfoods, it's all for example, if I want to have omega-3, not essentially that living in Punjab, Pakistan, I have to opt for salmon fish, which is probably not going to be available all the time. Yes. So you can go for the plant sources like flax seeds, which is indigenous native language. It is called alsi ke beej. You can go for the walnuts. You can go for the regular kind of the food which is available around you. And for sure, the key to success in nutrition is the moderation. The amount of the food has to be in moderate quantity.
Yeah, not excessive. Yes. Absolutely. Ajay, what would you say? How do you rate desi ghee? I think this is something at least which is local, available for everybody.
Yes.
How good is it in terms of nutrition?
Well, there are two sides of the coin always.
Achha.
So desi ghee is in a way, it is good.
Okay.
It's organic. But on the other hand, it is saturated fats. So it's much hyped thing that is acting around. I often tell people that many hyped things, they are acting up around us. So be very watchful. If desi ghee taken in moderate amount is fine. For the growing kids is okay. But if I am already at the risk of developing hypercholesteremia, why on the earth would I adopt the practice of having desi ghee? So small.
So what's if they don't want? What would you advise if somebody has elevated cholesterol levels, triglycerides, and LDL? They don't have a good ratio of LDL, HDL. What is the one or two pieces of advice you would give them?
Well, we all know that any healthy liver, any normal human healthy liver has to synthesize cholesterol.
Yeah, absolutely.
Yes. So the more substrate or the raw material you're going to give to your liver to synthesize extra cholesterol, the bad it is going for the people to be with the hypercholesteremia. So the first thing is to cut out the saturated sources of the fats from their plant.
And that's mainly found in processed foods,
trans fats.
I think there's a big trend of bakery food in Pakistan. The people love to get bakery stuff. And what is the danger of consuming bakery foods on a regular basis?
Well, you know what? every bakery item has the culprit trans fatty acids.
Trans fatty acids, yes.
The hidden fats.
And what is the damage they do to us? They just really...
Well, not only raise your cholesterol levels, not only clog the arteries, not only have
so
bad
much,
impact on the skin. I mean, numerous impacts.
Skin, exactly.
True that.
So does, and in your opinion, excuse me, does sugar have a negative or positive impact on skin?
You're asking me the questions as if you're reading my mind. This is
great minds think alike.
Well, yes, indeed. Right. So these are all the questions all the nutritionists would be wanted to ask by. So any kind of refined sugar is not only detrimental for the health, it is bad for the skin, it is bad for the cardiovascular, it makes us prone to the cardiovascular diseases.
Exactly.
So what not? So if we simply cut out refined white sugar from our diets, I mean, one good pleasant thing we would do to ourselves.
Amazing.
Yes.
Amazing. And finally, the last one, I think a lot of people want to, obviously they want to have quick fixes and shortcuts, and they have people come to me as well and say they have a wedding in 1 month and they want to lose weight. And what is the one advice you would give our lovely followers, a safe way to lose weight in a short period of time, if there's any such thing as that?
Well, this is this is equivalent to having the crux of the talk, actually. Make the changes which are going to be permanent in your lifestyle, very long term. And initially, to roll the plan out, we all are human beings. We all are result oriented. So initially, try to look for the things which can at least cut out the bloating part of the body. That gives the results. So 15-16 days, they can do some induction programs that can at least trigger their weight loss journey. Yes.
And so if they like to come to you, and I also refer my patients to you, so that's what you would do. You create a nice little plan for them to follow, something which is easy, not very complicated, and they will achieve healthy weight loss.
Well, I do carry many stories, the success stories. Yes, initially we roll out the plans, which are doable, not too very fancy to follow.
And do they have to keep coming back to you? Or
absolutely, yes.
Okay. It has to be
only because
thing.
Of the reason, not for any other reason, only because of the reason the body actually requires the change to just to be playful with their metabolism. Your patients tell that Dr. OBT has abracadabra spell, probably, yes. So many people trust me equally.
That's really good.
So yes,
I think success lies in consistency. I think that if they're consistent and consistently following an expert's advice, there's more likelihood of success. That's what I believe in as well.
Primarily, for sure, yes.
Thank you so much for being here today. And I think this is probably going to be the first of many more, inshallah, to come. And if there's anything last you'd like to say to our followers before we sign out, so please feel free.
For sure, yes. Nutrition is very important for the vitality of the health. So for the health rejuvenation, consider yourself precious. And for being precious, focus on little small nutritional needs that is actually your right. So focus on your health, focus on good nutrition, and best of luck.
Thank you very much.
Thank you.
Thank you very much.